What is plastic surgery? Who are plastic surgeons? What all does plastic surgeons do? Myself, Dr. Prince, a plastic surgeon at Sushrutha Institute of Plastic Surgery, Elite Hospital, Thrissur. So, as per Wikipedia, plastic surgery is a surgical specialty involving the restoration, reconstruction or alteration of the human body. For better understanding, I will split each terms and elaborate on each of them. So first, restoration. Restoring something to its original form. So consider this example. A guy got his finger trapped in a machine and a part of it got amputated. So we can replant or refix that amputated part of finger to the hand to restore the form. Next is reconstruction. Now consider this example. The same guy, if his finger is amputated and due to some circumstances he couldn't bring the amputated part to the hospital, or the part was fully crushed or mangled. Now the problem is we cannot replant the part. Instead, an option available is we can reconstruct that lost finger using another body part. In this case, we have reconstructed the lost finger using a toe from the feet, considering the function of the hand is more important than feet. Similarly, most of the body parts that are lost can be reconstructed using plastic surgery. Maybe we cannot make an exact replica but can be matched so that form and function are maintained. Next is alteration. An example is this condition is known as macrodactyly or large fingers. So we can alter the shape of that finger to a near normal look. So why is this specialty known as plastic surgery? Is it because we use plastic in it? No, the word plastic in the plastic surgery got its origin from the Greek word plastike, meaning to mold. So we can mold the form and function of a body part using plastic surgery. Plastic surgery can be divided into two subspecialties. First one, reconstructive plastic surgery, and second one, cosmetic plastic surgery. The term cosmetic surgery is more familiar to us. If we hear that someone has undergone a plastic surgery, we will consider that he has undergone a cosmetic surgery procedure to enhance his beauty. But the fact is that cosmetic surgery is only 30% of what we do as a plastic surgeon in Indian scenario. And the 70% of what we do is a reconstructive plastic surgery. But we can expect a 50-50 ratio in the Western world. So I'll get into details of these two subspecialties. First one, reconstructive plastic surgery. It is done to correct the functional impairments. So these impairments can happen due to burns, trauma, cancer, infection or by birth. The goal of reconstructive plastic surgery is to restore both form or the look and function. So now see this example. This child has suffered an injury to his forehead following a fall. The basic management for this wound is to suture the wound. So if it is done by a plastic surgeon, he will do micro sutures for this wound under high magnification to get a very clear wound closure, leaving very minimal scar. In this case, the plastic surgery done is micro suturing to reduce the scar and improve wound healing. Similarly, wounds over any other part of the body can be repaired by a plastic surgeon so that the scars are less. In case of a deep injury, all the structures cut like nerves, arteries, muscles will all be well taken care of, leaving less chance of infection and faster wound healing. In this case, there is a defect in the upper lip with loss of a part. Now, simple suturing won't be possible in this case. So we have to advance the surrounding skin to cover the defect using plastic surgery techniques. Similar thing can be done for defects over other parts of the body. A defect over the nose, a defect over the eyelid, a defect over the pin of the ear, all can be reconstructed using plastic surgery. Congenital anomalies or birth defects like cleft lip, microtia or small ear can be corrected by plastic surgery. This condition is known as craniosynostosis, a large head. And this is a facial cleft, another birth defect. All these can be corrected by plastic surgery. Now, this is a birth anomaly with poorly developed thumb or a floating thumb. In this case, as you see, there are fused fingers. In this, there is a deviated hand with absent thumb. A lot of similar abnormalities happen in hand and at birth, which can be corrected by plastic surgery. Next group of surgeries what a plastic surgeon do is nerve surgeries. Example, in this case, he is having a facial nerve weakness causing deviation of angle of mouth, droopy eyes, like that. In this case, the guy is not able to lift his wrist or fingers of one hand. It happens due to the weakness of something known as radial nerve supplying the hand. Next is a brachial plexus injury seen in children following birth and in adults following an accident. They won't be able to lift or move the entire limb, and hand will go into a non-working posture. The hands will have muscle wastage and look like thin compared to the normal hand. It's because of the damage of nerves coming to hand known as brachial plexus. These kind of nerve injuries can be corrected by plastic surgery. Next is treatment of burns caused by various ways like fire, hot water, electric injuries and so on. Once the burns happened, it can lead to contractures or fixed deformities of that part, leading to restricted movements of that part. The management of burns and its complications can be corrected by plastic surgery. In this, contractures of the neck or the hand can be corrected by plastic surgery. Now next is an oncoplastic surgery, the reconstruction of a lost part after cancer surgery. Example, this lady lost her breast after cancer surgery. In initial days, there was no option for the breast reconstruction, but these days we can do it with plastic surgery. Similarly, it can be done for any other parts. Now next is a microvascular surgery using high-end microscopes and loupes, so which include microsurgeries, replantation of amputated fingers, flaps. In this, we repair very minute structures under high magnification. So if there is a defect over some part of the body, we can bring another tissue from some other part as a flap to cover this defect. These are known as flaps. Example, there is a defect over the leg, and we can take a flap from thigh to cover that defect over leg using microvascular surgical techniques. So this subspecialty of plastic surgery dealing with minute complex structures is known as microvascular surgery. And next major division of plastic surgery is cosmetic plastic surgery or cosmetic surgery. Though most of us don't know what all are included in cosmetic surgery. Tummy tuck surgery or abdominoplasty to remove excess hanging tummy which is not lost with exercise and dieting, especially seen in females after 2 to 3 pregnancies. Rhinoplasty to correct deformity of nose like a crooked nose or a hump over the nose are seen in the picture. So some males will have enlarged breast causing an embarrassment. This condition is known as gynecomastia. So it can be corrected effectively by plastic surgery. So some females have large breast, few have small breast. So a reduction or enlargement of the breast can be done by plastic surgery. Orthognathic surgery to correct the jaw. In this lady, there is a retruded jaw. Lower jaw is standing back. In this lady, instead, the upper jaw is standing backward. These conditions can be corrected by plastic surgery. Aging related changes happen in our body in the form of wrinkles, droopiness, lax skin, fat loss like that. It is very much evident over our face. A lot of surgical and non-surgical options are available for this. Non-surgical treatments include Botox, fillers. A surgery to correct lax skin on the face is facelift. And under eye bags are seen in guy can be corrected by blepharoplasty. He also has a droopy upper eyelid which can be corrected by same procedure, that's blepharoplasty. A droopy eyebrow happens with aging, can be corrected by brow lift. Not just face, other part of the body also faces similar issues. Example, a hanging skin over the arms, skin excess over the thighs, excess skin over after a bariatric surgery can be corrected by plastic surgery. So plastic surgery is a very broad specialty. I have tried to give a basic idea regarding the specialty using this video. Hope it helped you. Thank you.